Hi, in this video, we're going to review a few things that we want you to know before you head to sim. Know before you go in your first simulation. So objectives of this video are we're going to review the expectations of you during the simulation, provide a room orientation, discuss vital signs, review how to use the medication dispensing device, and talk about documentation. So you should have completed your pre-work, or you should complete it by Monday evening. It depends on your instructor, but you need to submit it by the due time. We start sim early. We get there about 6 a.m. to make sure everything is ready. So we will not be able to be checking it on Tuesday. So make sure that you get it submitted on time. What we're looking for is drug cards for the medications that will be administered. We are also looking for a pathophysiology statement or a card. And what that is a brief statement explaining what the problem is. So for example, with Sophia, it's ORIF of her hip. Professionalism, we expect you to arrive on time. We are meeting in one of the classrooms, and that's posted for you. You need to be in your clinical uniform, and that means no SNA t-shirts. You need to be dressed as though you're going to the hospital. That includes jewelry, that includes hair, that includes making sure your tattoos are covered. We don't want to have to take points off for being late or for you not being dressed appropriately. Also, make sure you have your tools. That includes your watch, your stethoscope, a pen, and don't think that we don't notice when you're whispering to your partner about, because you're the one that got assigned to take vital signs and you don't happen to have a watch on you, because we do notice. So make sure that you bring your stuff as though you are going to the hospital, because simulation is clinical. In simulation behavior, we do expect you to perform assessments that are required, and we expect you to communicate. Communicate with each other, listen to your partner that you're working with, and listen to the patient. We're going to go over a room orientation. You would have done this the first week of class when we did orientation, but this is just a review for you. It's very much like a nurse's station in a hospital ward. This is in one of the rooms. You see the sink. There's the vital sign equipment is right in the drawer. The blood pressure cuff is on the mannequin. I'll show you that in a minute. There's a 360 zoom of the room. This one has medications in it. It has the alcohol wipes. It has needles. It has syringes. It has flushes for flushing the IV. Everything you should need regarding IVs and medications. Should you need to call the doctor, the phone is here. You just push the button and the phone will ring. To take vital signs, this was also in the room orientation video, but to take vital signs, temperature, you need to get the thermometer out of the drawer, you need to pick up the thermometer, you need to take out the probe and head it to the mouth. Then the person in the behind the glass will give you the temperature. The pulse, you should be able to count it. Count it at the radial. It should be an approximate anatomical position. With the mannequins, make sure you don't push too hard, because sometimes we can obliterate it when we push too hard. If you can't feel it, then listen to the apical pulse. Again, listen in the approximate anatomical positions. On the mannequin, sometimes it's easiest to hear the apical about Erb's point, so about the third intercostal space on the left. Respirations, you should be able to count, and you should be counting those. Blood pressure, so we will have it set up for you so that you can use the monitor for the blood pressure. If for some reason that's not going to work, depending on the mannequin, some you put your stethoscope in the normal anatomical position. The blood pressure cuff is already attached, so don't remove it. Some you just put it in the antecubital area and you should be able to hear it. Some there's a little dot, and the pictures are in the video. There's a little dot there that shows you how to or where you need to put your stethoscope. You still inflate the cuff, deflate the cuff, and you should hear the Korsakoff sounds. The thing with listening with the mannequin is computer. And so when you're listening with your stethoscope, you're hearing all kinds of sounds. You're hearing squeaks and the breathing, and you're hearing all of that. So you have to zone in and really try to concentrate on the sound that you're listening for. Blood pressures are, depending on which mannequin, you might have to put your stethoscope on the dot here, or you can put it in the normal anatomical position. Your patient may have some things displayed on the monitor. To take the blood pressure, you push NIBP and a menu comes up, and then you push STAT and it will take the blood pressure, and the number should change at that time. The O2 sat is going to be on the monitor for you. So with any of the mannequins, don't take the blood pressure cuff off unless you find it off of the patient. Then that's different, but just leave it in place. Assessments. We want you to do focused assessments depending on which simulation we're in. This is an overview. Know before you go, depending on whether you're seeing Sophia or you're seeing Ralph or whoever we're seeing this week. So make sure you listen to or do your focus assessment based on your patient. When you're listening to breath sounds, listen. We only expect you to listen anteriorly and not posteriorly because we don't want you lifting the mannequin up. But listen over approximate anatomical positions. Remember that we're not trying to trick you. We aren't setting you up. These are mannequins, they're computers, and so you hear a lot of the sounds of the mannequin, of the mechanics of it. So we're not trying to trap you. The majority of the time you're going to hear clear breath sounds, unless we expect to hear something else, and then we'll talk about that if that's what you hear. Pulses should be palpable at approximate anatomical locations. So if you are taking some care of somebody with a fractured hip or a hip repair, it would be important for you to check the pulses distal to that repair, and those should be palpable for you in the approximate anatomical location. If there's a dressing, if there's a drain, if there's any kind of tube like a Foley catheter, if they voided in the bedpan or in a urinal, don't empty that. Look at it, note the color, have an idea of approximately how much is there, but don't take it off because we want the sim to be the same for everybody that follows you. So we don't expect you to empty it, but do keep track of what's there. This video is going to show you how to use the medication dispensing system. We do have it up and running for you, and so any oral medications or any medications due during the simulation will be in the medication dispensing system and are set up under your patient's name.
Welcome to your orientation on using the Touchpoint Medical Dispensing Unit, also known as the Pyxis. You'll be using these units in your simulations. If you notice, the screen has a sign-on and a password. Looking down on the shelf of the Pyxis unit, you will see the sign-on is student. You will type that in exactly as it appears, and your password will be nurse678. You will then hit enter. Excellent. This is the next progression of screens. Please always follow the prompts on the screen. Hit the word OK. The patient that we will be using in this simulation is John Adams. You can type his first 3 letters of his last name. John Adams then becomes highlighted. Click on his name and read your screen. Just say yes. Here are his medications. At this time, the medications that are due are cefzolizine. If you notice it highlighted, it's also known as Ansef. The other medication that is due is enoxaparin, also known as Lovenox. So we will be touching cefzolizine first. Okay, you have a safety alert. Again, please read your screen. Have you selected the correct medication? The answer is yes. Tap the screen.
direct causes.
The next medication
To my bank account.
is still, it's saying suggested order amount is 1. Press enter. If you were giving more than one medication, you would be typing in 2. In this case, it is 1. The other medication that we will be giving is the enoxaparin. Let's tap that screen. Also telling us that the dose should be 1. We're going to hit enter. If you notice down on the bottom, there are the 2 medications.
A debit card or
You're now going to hit press to open drawer.
and it's one and the same.
And there are the medications. There is your cefzalazine, and then it told you to press the next screen, and you will be now getting your enoxaparin. Once you've gotten that medication from the drawer, you would close your drawer and log off. You will then be going to administer the medications to your patient. Remember your 6 rights.
The day of simulation, you're going to be pre-briefed on the expectations of you during the simulation, as well as be provided a report. Now remember that the real key to success in simulation is to communicate. Communicate to your patient and communicate to your team member. Do some of your, we want you to actually do, not just tell me what you're going to do. We want you to actually do it. But we also want you to say out loud, I heard clear breath sounds. I counted a heart rate of 88. I heard a blood pressure of 120/80. Say those things out loud so that your partner can hear, but so that we can also hear that you've done that. Also, if you're talking to the patient, if you're asking them questions and listening to them, you're going to get a lot of clues, and that's true with whether it's a mannequin or a real patient. So patients will tell you, oh, I feel very lightheaded. Oh, that really hurts when you did that. So you should be able to pick up the clues of what you need to do and where you need to assess and whether you need to medicate or not medicate. Or in the case of feeling lightheaded, whether or not you need to check a blood pressure or a blood sugar, anything like that. So documentation, you're going to have in the room a Surface Pro computer, and it's going to have electronic chart. It's an abbreviated one of the one that you've had access to all semester. So it's just a few of the pages. It's going to be the nurse view that you'll see. It's going to be the physician orders, and the MAR are going to be on it. I think that's all that we put on it. It's 3 or 4 pages. So it's a limited version on the Surface Pro. And with that, you should be able to find your orders and your MAR and everything that you need to do. You're going to also be given this week a 1-page care plan. That's what you're going to submit for your documentation. You can write all over it. We're not going to collect it on the day of sim, but you are going to have to scan it and submit it to us once it's complete. We do want them handwritten. We want to be able to see your thought processes. And if you're working with your team member, you need to make sure that you share vital signs and that you share assessment findings. We also don't want you to lie about it. So if you didn't check something on the patient, then just say did not assess. And that's it for this. Thank you.